At Glomeria Therapeutics, our first R&D commitment has been to abolish the risk of bacterial contamination in peritoneal dialysis therapy. And thanks to our connecting devices, we hit upon the first-ever solution to the contamination problem in PD. Before connecting the patient set to the disposable unit, a cover is removed. The patient set N is still sealed by the cap, along with a safety valve, which is an additional barrier to potential contaminants. The disposable unit, hitched up to inflow and outflow bags, can be connected. A slight twist and it clicks home, guarded against unscrewing by a safety catch. Pushing the patient set towards the disposable unit removes the cap from the patient set and secures it firmly in place on the disposable unit housing. Though in a sealed chamber, the patient set is further protected by the safety valve, stopping the flow as an additional safety measure. The cap moves away from the connection point as the disposable mechanism gradually shifts in a twofold movement towards the patient set end onto which it finally lodges, pressing the safety valve and opening the inside of the catheter. A line clamping system is activated by rotating the hand grip first, draining off any liquid left in the abdomen, and then letting in fresh liquid. The flow lines are themselves contained within the disposable unit housing. Not having any liquid inside the housing is yet another safety feature to make doubly sure. When the inflow is over, another twist of the grip detaches the mechanism from the patient's set, moves it away, and aligns a new sterile cap for final closure. Pushing the patient set towards the disposable unit fits the cap onto the patient set and deactivates the safety catch that has prevented unscrewing. The patient set can now be disconnected and the cycle terminated. Glomeria Connector, the first ever solution to the contamination problem in peritoneal dialysis. Glomeria Therapeutics, committed to unmet needs.